Dear ladies and gentlemen, on behalf of Zbigniew Dyrdziuk, President of the Social Insurance Institution, I would like to welcome you to the conference entitled Prevention as a Route to a Safe and Healthy Future, Health, Demography, Technology. I'm very pleased to welcome Minister Chief Health Insurance Inspector. On behalf of President of KRUS, I would like to welcome Mr. Wicherek, Chief Medical Practitioner of KRUS, Dr. Engineer Piotr Litwe, President of the Mining Institute, Zbigniew Janowski, Deputy President of the Health Inspectorate at the same, Iwona Zakrzewska, Director of the Center for Social Partnership Dialogue and Office for Social Dialogue, who is with us online. Mirosław Bagiński, President of the Board of the Mining Rescue Service. Weronika Dejneka, Board Member of PZU Zdrowie SA. And Professor Danuta Koradecka. I'm very pleased to welcome representatives of government and local authorities, representatives of trade unions who have decided to attend this conference. On behalf of the Supervisory Board of Social Insurance Institutions, we have its president and members, Renata Górna, Dr. Elżbieta Ostrowska, and Joanna Stachura. Please forgive me for not mentioning all eminent guests that have attended this event. I'm very pleased to welcome speakers and panelists and partners of our conference who have actively joined in the preparations. I'm very pleased to inform you that this conference is a part of the 19th anniversary of the operations of Polish Insurance Institution, and this event is held under patronage of the President of the Republic of Poland, Andrzej Duda, National Health Insurance, Health System, PZU Zdrowie, Central Labor Institute, Research Institute, Medicine Institute named after Jerzy Nofer in Łódź, Higher Mining Institute, and the Association of Health and Safety Worker, Akademia Górniczo-Hutnicza in Kraków, Salt Mine in Wieliczka, and Coalition Safe at Work are the partners of the event. I'm also pleased to welcome the patrons of and media of the event, and Mrs. Bieniasz, the President of Social Insurance Institution, President Jaroszek, President Mariusz Jedynak, and President Sławomir Wasilewski. I'm very pleased to welcome heads of the individual departments of ZUS, including Department of Prevention and Rehabilitation and its director, Mrs. Dobrowolska. Let me emphasize that the Department of Prevention and Rehabilitation has organized today's event, and I would like to thank Madam Director for having me here during this excellent event. I'd like to extend a warm welcome to the Director of Individual Units of ZUS, and now I'd like to welcome the host of today's conference, Mr. Dyrdziuk, President of the Polish Social Insurance Institution. Dear ladies and gentlemen, Minister, Presidents, and my dear friends, I'm very pleased that this event is attended by such eminent guests, and it is important to think about the topic of today's conference. We should prevent it. We should look at it from many angles. We are focusing on prevention and rehabilitation, but we are to focus on two main areas. First of all, I remember from my young age, we had an outpatient clinic and insurance company which were combined. And today we are celebrating the 19th anniversary. And as it was the case with the 80th anniversary, we were celebrating throughout the year. So we are going to continue this tradition during the 19th anniversary, and focusing on the two areas that are important to us. We are going to focus on rehabilitation, and we are going to devote a whole panel to this topic because it is very important to bring people back to work after accidents. And a social insurance institution aims at reintroducing people to work and making sure that they are active in their lives, in private and professional lives. When we have been developing different forms and we are caring of the rehabilitation, the social insurance institution offers the longest period of rehabilitation. And we have very high requirements of our partners, contracting partners. And we are developing different areas, and we focus on different diseases, to mention even the rehabilitation of voice in the case of teachers. So this is just bringing back to full capacity of conducting your professional work, just like it is in the case of teachers who cannot work without their voice. Then accident rehabilitation. I'm very pleased to see Dr. Radecka. And when I look at her, I'm just reminded of 2010 when ZUS has introduced different forms of after-accident rehabilitation, and accident fund is a surplus fund, and it happens so for this reason that we offer prevention there of good quality. So if you combine prevention, ownership, and incentives, this brings very good results. We have worked with many different employers working on the program Safe at Work. So I still have gadgets from this program which were saying, stay safe at work. And this is very important element to remember about that. Another important aspect is the fact that employers can apply for funds to improve working conditions for their staff members. And in my opinion, it was thanks to Professor Radecka, who has made sure that the fund assigns 1% of its revenues for prevention. And what is the result of it? It is nearly 120 million zlotys that we distribute as part of transparent programs. But when we look at the percentage, the contribution, accident contribution, can be lower thanks to prevention. So this is the focus, the direction we want to promote. And because of demographic aspects and the resources of the labor market, it is of great importance to make sure that all people of working age are professionally active. So we need active workers who are active on the labor market. because the number of people of working age is steadily decreasing. This is why it is important to boost professional activity, and you can do it thanks to rehabilitation. So this is why our conference is of such great importance, and I'm very pleased to open this conference, and I'm very happy to see so many eminent guests, speakers, and panelists. On the other hand, this event to celebrate the 19th anniversary of the operations of our institution, I believe this is a great opportunity to acknowledge the merits and the hard work of its staff members, who contributes to the whole well-being of the whole society. So I'm very pleased that we are here today, and I'm hoping we are going to have very fruitful discussion, and we will gain knowledge, and the facts that we will discuss will impact the reality, and will make sure that it translates to praxis, and you know, when you prevent, you are well insured. So you need to get well prepared to make sure to have more luck, more health, and more active workers on the labor market. Have a great day. Thank you. Thank you, Mr. President. So today's conference is a great opportunity to share with you information on international activities aimed at prevention taken by the social insurance institutions. ZUS is active on the international arena, and we have joined a very important initiative under the auspices of ISIA, and this is Vision Zero strategy, which is based on taking care of safety, health, and well-being. And our activities will complement this strategy, and we are sharing good practice and experiences with social insurance institutions from all over the world. And we are the Secretary of International Society for Security. The President of ISA has addressed us during.
It's an honor to speak to you today at this important conference on prevention as a route to a safe and healthy future, health, demography, technology, organized by the Polish Social Insurance Institution, ZUS. As the Secretary-General of the International Social Security Association, I wish to convey my greetings to our host, the President of ZUS, Mr. Derjuk, and to all participants of this meeting. As we gather here, we are reminded of more than 2.9 million work-related fatal accidents worldwide and the critical role that social security institutions play in ensuring a safe and healthy future for all. Social security systems are the backbone of societal well-being. They provide a safety net that not only supports individuals in times of need, but also plays a proactive role in preventing risks before they manifest. As part of its social security services, ZUS provides benefits and support for workers who suffer from occupational accidents and disease. This includes medical treatment, rehabilitation, financial compensation, and pension benefits to help affected individuals manage their condition and maintain their quality of life. For the International Social Security Association, a proactive approach to social security, where the focus is on maintaining health and well-being, is essential in fostering a culture of prevention. ISA acknowledges the critical role of prevention, and through its Special Commission on Prevention has crafted a strategy known as Vision Zero, a vision where every accident is preventable. This strategy offers easy-to-implement solutions for companies and policymakers. There is a wealth of material available on the Vision Zero website, from the 7 golden rules to prevention guides, and from benchmarking tools to checklists for companies in all areas of economic activities. I'm most grateful that ZEUS has decided to join a community of over 16,000 Vision Zero supporters and is now starting to roll out a Vision Zero action program. Today's conference could mark the beginning of a new and important step. With ZEUS' commitment to ISA's Vision Zero strategy, we can achieve fewer work-related accidents and occupational disease in Poland. The goal of Vision Zero is to bring these numbers down, and many ISA members have reported positive outcomes. Joining Vision Zero is a testament to ZEUS' commitment to prevention. Moreover, the integration of technology and the focus on health and well-being in prevention strategies is crucial. Innovations such as wearable health monitors, artificial intelligence-driven risk assessments, and real-time data analytics can significantly enhance our ability to predict and prevent workplace hazards. Demographic change, such as an aging workforce, also necessitate a renewed focus on prevention. Tailoring preventive measures to address the specific needs of older workers will ensure their safety and enable them to extend their working lives. International collaboration is another key element. By sharing best practice and learning from each other, countries can collectively improve their prevention measures and create safer working environments globally. In conclusion, prevention is not just a strategy, it's a mindset. It requires commitment, collaboration, and continuous effort. Social security institutions like ZEUS play a crucial role in this journey, providing the foundation upon which a culture of prevention can be built. By adhering to the principle of Vision Zero and embracing the possibilities of technology, we can pave the way for a future where safety and health are paramount. Thank you very much.
Thank you very much for this message. And now let us move on to a very important part of our conference. And I'm saying that because prevention is a good example of institutional cooperation, and Polish legislation assigns prevention to many different institutions, and the responsibilities of ZEUS include different elements and cooperation with various partners. And this conference is a good opportunity to thank our partners for good cooperation. And the president of the Social Insurance Institution has funded the award for the improving the conditions for the safety and health protection in 3 categories: Leader of Cooperation, Prevention Project, and Ambassador of Prevention. So I would like to ask President Derdziuk on the floor to award the Prevention Award to the National Health Inspectorate. National Health Inspectorate has been awarded for comprehensive cooperation with social insurance institutions in many areas, including prevention, promotion, and information. Joint initiatives are conducted at the central and regional level. Representative of the inspectorates promote a program of prevention aimed at workforce staying active throughout their working life. For many years, ZUS and Inspectorate organize a public awareness campaign to promote knowledge on threats. Mr. Minister, Mr. President, please come back to the stage. Let us continue the laudation. So cooperation and commitment of our organizations contributes to growing awareness and information sharing to promote good practices in management of safe working conditions. Please take the floor, Mr. President. Well, I have been very surprised because I was informed that I'm not going to speak. I'm not going to give thanks. But what I want to thank, this is what I want to say. This is a very important distinction for us because to us prevention is of great importance, and cooperation with ZUS is also we value it very much. So we, as National Health Inspectorate, we have joint responsibility with ZUS. We want to make sure that labor force is healthy. So I want to thank you. I will not to talk too much. So once again, thank you very much. So now I will start with the presentation of the prevention project, which is given to the Central Mining Rescue Station in Bytom for the project, which in the competition for improving the working conditions and hygiene. So this was the winning project in this competition, and the funding awarded as part of this competition contributes to improving working conditions at the heights and when servicing the equipment and of giving during rescue operations and to improve working conditions. So this project is very helpful in actions to save lives and health. I would like to ask to the floor President of the company, Mirosław Bagiński.
The floor is yours. Just as the minister, I was not really prepared for this, but thank you very much for the recognition. I would like to mainly congratulate the employees of the Central Station, and that because it's their initiative and it builds positive perspective. And the last but very important category is the Ambassador of Prevention, and the award goes to Professor Danuta Koradecka, PhD of Medical Sciences. She, between 1989 and 2020, she held the function of the Director of Central Institute of Labor Protection and National Research Institute. She was also the chair of the Labour Commission and a member of the Council of Labour Protection. She was many times proposing to change the Polish system of accident prevention, and the effect of it was, among others, initiating the work on the Act about labour safety and prevention of accidents. And thanks to this, we have an increase of the budget from 1% of contributions to accident insurance. The other effect is that catalogue of the tasks of ZUS from the scope of accident prevention was extended into activities helping employees to maintain their capacity to work throughout their whole professional activity. She was also supporting the financing plans of ZUS in cooperation with Central Institute of Labour Protection. The activities of the professor support her becoming the first lady for the security, labor and health security. Professor Danuta Karadeska is a real ambassador of prevention, both in the country and on the international arena. And we would like to ask dear professor to take the floor. And dear ladies and gentlemen, dear President, this recognition that I received here among such distinguished guests of my colleagues is a moment which requires certain reflection about the development of preventive actions of ZUS, and also some special role of social insurance institution aiming at the zero vision. The first stage was definitely diversifying the insurance contribution, depending on the number of accidents and working conditions by each sector and then by each company. It had a motivating effect. At that time, it was under Andrzej Bączkowski. That was the first such movement. And at that time, we were working with a German social insurance system. The second stage was diversifying not only the contributions, the amounts of contributions, but also activities which allowed the reform of bridge pensions, and here, under the supervision of Professor Wanda Minczak, we had a certain contribution here, and that was a very good cooperation for the so-called science, cooperation between science and higher office. And the third stage, which was also very important, where we changed somehow the image of ZUS, a repressive, let's say, image, focusing on executing the contributions, into a different image where ZUS supports activities for prevention of accidents and occupational diseases. And here, apart from traditional activities like research and technical solutions implementations, we have system activities that were mentioned by the president of ZUS. For example, the insurance contribution below 1%. And this is especially important for small and medium enterprises, which do not have resources even for such small investments in security and labor conditions. So I think that we cannot stop at this point. And as I look at President Derdziuk, Madam President Bieniasz, Vice Presidents, so the whole department of Director Dobrowolska and Director Sujka, these are the people who are still here and who will continue this topic. And we are still facing the problem of occupational accidents in remote work, and we had 240 of them last year, and also the extended reality, which also creates new challenges in terms of trainings and solutions, which we cannot even fully define at the moment. So I would like to wish ZUS to continue their work and to continue this cooperation open to new challenges. Thank you very much, and give us more. Thank you very much for this presentation. Please stay here on the stage. Congratulations to all the award winners, and I would like to invite all of you, all of the award winners, to the stage to take a photo. As you see, this is a very pleasant event. Thank you very much for preparing this. I would like to congratulate all the award winners. As you see, it's a connected element. The mining rescue station got the reward because they are most active in applying for the resources which are available within this 1% contribution. So cooperation with the state labor inspection is also very efficient. So thank you. I'm glad that we could present the award to Madam Professor, because this is the real ambassador of prevention. I would also like to thank all my employees, the board and the department who prepared this conference, but who also on a daily basis carry out those activities, because they are really important and they have tangible results. So thank you very much, and I wish you a good day. Thank you for this presentation, dear ladies and gentlemen. And now the first panel discussion devoted to health. Health is a category which is very special in the system of social insurances, because many constructions of social insurances are based on this. Also, preventive activities implemented by ZUS are directed at maintaining the capacity to work, and part of them are related directly with the improvement of our health. That isn't the case of medical rehabilitation implemented by ZUS within a pension system. So let's start the discussion, panel discussion. The moderator will be Iwona Szymala, a journalist and chief editor. So please come to the stage. Welcome. I would like to invite our panelists, but before I introduce our guests, I would like to thank you for the invitation and for the possibility to discuss among such distinguished guests, because let's admit that here on this couch we have the best experts of public health. So thank you for accepting the invitation. Małgorzata Gałązka-Sobotka is with us. We have Professor Grażyna Brzóżkiewicz-Kuźmicka, who is a distinguished expert in terms of physical activity, sports. But we'll be talking about all this. We also have Professor Piotr Gałecki, who you know very well because he's a national consultant in psychiatry. So he will tell us about the problems related with mental health problems. We will be talking about this as well. We also have Professor Andrzej Chwal, who is a great expert of public health, and Professor Mateusz Jankowski, Medical Center for Postgraduate Education. Thank you, dear Professor, for accepting the invitation. You see, the title of the panel is Health, but Public Health as the most precious value. So experts will tell you about public health in a minute, but many elements make up for this notion. This is also monitoring the state of health of the society, collecting data about the most common diseases of the Polish citizens, but also collecting data in order to design adequate strategies of activities, in order to conduct the prevention that you were mentioning already today. These are also educational activities. So there are many elements that we would like to discuss today. But also, as President Derdziuk mentioned, what is so important? It's important that we live in good health and we stay active for many, many years, so that we all take care of our well-being. So a lot is also in our own hands. But as we look at the data, and Professor Jankowski, let's start from the data. The data is very alarming. In 2023, around 22 million medical certificates were issued stating the incapacity to work. This is over 237 million days of absence at work. Can we say that any activities from the perspective of public health can be taken in order to stop this wave of sick leaves? This is definitely very alarming data. Yes, indeed. We have tools that we can use when we talk about absence due to sickness. When we talk about sickness absence, we have to talk about two groups. First of all, preventing and then shortening its period. When we talk about the prevention of sickness absence, there are a lot of activities called the medicine of the lifestyle, because over 70% of deaths in Poland and deaths in developed countries are thus related with civilizational diseases. And those diseases are mainly related very often with people who are professionally active. They are also related with health style. And the place of work is thought by WHO as the main place is shaping a lifestyle, because we spend 1/3 of our life, let's say, at the workplace. So this has a lot of importance in shaping our health choices, but also the groups in which we work, because when we work in a certain place, we have similar socioeconomic conditions, and this is very essential. And when we look at what the employers can do in cooperation with ZUS, as the promoter and educator of health, these are all the activities directed at interventions related with changing the lifestyle. First of all, nutrition, physical activity, addiction, stress that accompanies us all the time, and relations. So all these things that we can address as employers and experts from the Public Health Office. So we can do that in order to decrease the sickness absence. So we have to provide conditions for the employees so that they can eat a nutritious meal or bite at the workplace. The way we shape the physical activity here, the obesity pandemic is an important factor. The way we manage stress in the workplace, but also the relations with other people. This is very important in the context of mental health. On the other hand, we should also remember that we need to promote good practices, because what is the main cause of sickness absence? It's mainly the muscular and skeletal diseases, but also the respiratory system diseases. So here we talk about prevention by, for example, protective vaccinations, which are very helpful to prevent various viral and respiratory diseases. And another condition is activities directed at coming back to work faster faster. So here, for example, rehabilitation, it's very important that we can provide such organization of health protection so that the employee can go back to work as early as possible, but also activities focused on implementing such therapies and various paths and coordination of health protection so that the employees can get back on their feet after the disease as fast as possible. So this is very important in terms of functioning of the society and economy. So what we can do together is the prevention directed at the lifestyle, infectious diseases, which can be prevented, and also promoting good practices of medical rehabilitation or a fast return to work through organizational changes in healthcare system. Thank you very much. Okay, workplace is one of the main environments that shapes our health behaviors, and also drawing the attention to the responsibility of the employers. So employers have, or they can create tools which will be directed at shaping a good health behaviors or change the attitudes of the employees, because this is just beneficial for everyone. And what you mentioned, the rehabilitation provided by ZUS, ZUS is doing things which are very needed. We do not know that much about it, so I'm glad that we can underline the meeting of the activities taken by ZUS. Professor Jankowski already mentioned this, that certain diseases like neurological or musculoskeletal diseases, but also allergies. So people who go to work, but they're not really present, especially when the disease becomes worse, or the problems of depression. These are the diagnoses that are most common, and they're related with high costs, social costs. Okay, so where do we start? How can we prevent it efficiently, dear professor? Don't worry. I do not get discouraged by the problem with the microphone. I'm sorry, but we cannot really hear very well. The lifestyle diseases are dominant around the world, especially in developed countries, including Poland. 93% of premature death, and also almost 100% of premature exit of the work market are those lifestyle diseases. However, if we look at okay, now it's much better. So, hello once again. So, once again, lifestyle diseases are undoubtedly the most essential factor of risk of premature death in developed countries, including Poland. This is 93% of premature deaths in Poland, and almost 100% of early exit from the work environment are also those diseases, those 5 main diseases of lifestyle. But if we look at the structure of sick leaves, sick absence, we have something else, because there it's the diseases of the musculoskeletal system diseases, and that shows us that the most frequent symptom at each medical office, doctor's office, is pain. Pain is the most common symptom of patients who visit physicians, and it's mainly among men at the lumbar part of the spine. However, and among women, it's usually abdominal pain. Therefore, the structure of sick absence is a bit different than the chronic disease structure. Therefore, I would like to encourage ZUS and the employers, and we are working on that, and I regret that we do not have the great ambassador of labor medicine, director of the Innofer Institute, who for many years has been fighting for including the occupational medicine to P1 platform to regular healthcare, so transferring all the prerogatives of the general physician to the occupational medicine, because these are resources which are not used enough. Why? Because the musculoskeletal diseases, which make up for 80% of all the sick leaves, 17% of all the absences, sick absences, are related with motor systems. So then this is a burden on ZUS or the employer, but now ZUS is supposed to be responsible of all of this, if I had correctly. So one way or another, it's a really big financial burden, and undoubtedly those diseases, from the point of view of current contributions, they are on top. Therefore, prevention of those diseases should lay at the basis, but the prevention should start at childhood. So, for example, children should not avoid physical education classes, children should do sports. It also starts from the young employees to sit on proper chairs, and so on and so forth.
As a result, we have less locomotor system diseases and less sick leaves. Thank you, Professor. You have indicated the biggest threats, and now I would like to ask Professor Gałecki for his contribution. Correct me if I'm wrong, more than 8 million people in Poland suffer from various types of mental disorders. So this is a huge number. And on the other hand, when you look at the data of concerning sick leaves, a number of sick leaves due to the depression is growing. Less cases of other diseases like schizophrenia, they are managed, but the challenge with depression is bigger. So how big a challenge for public health is it? Obviously, the professional burnout is also a case. And this is on the rise. So public health, well-being, and mental health disorders. Good morning, ladies and gentlemen. Thank you for this question. Yes, it is true that depression is called the modern civilization pandemic in all well-developed countries, and Poland is one of them. And this is and it is worth mentioning that in Poland, the spread of the depression is at the lowest level as compared to other EU countries. And it doesn't mean that we are a chosen country, but it means that the growth of this the depressive and anxiety disorders or the adaptive disorders are ahead of us. We do not look for genetic or biological reasons for this pandemic, but the reality of a modern world and the pace of life, there are more risk elements and more threats. And although we are living in bigger clusters, urban areas, we are getting more and more lonely. And coupled with the predisposition for this illness makes the morbidity growing. And as you have noticed, it has changed over the past 20 or 30 years, because in the past it was schizophrenia or bipolar affective disorders were the diseases that resulted in incapacity for work starting from the first episode. But the progress of drugs and the therapy results in the fact that these patients are staying active on the labor market, and after rehabilitation and after short sick leave, they come back to work, which is well proven by the rehabilitation payments to them. And so it is worth mentioning from the perspective of public health the topic of burnout, which is not a disease, but it is under CD11 dating back to 2018. It will be binding in Poland and EU. It is a condition, a health condition related to health and work, and burnout, professional burnout, results from the lack of mental hygiene, lack of awareness, and then the place of work can become a stressor, and people become less efficient, which is proven by research. A risk factor for anxiety and depressive disorders. So burnout is considered a risk factor. So all the elements coupled, classical elements coupled together, contribute to burnout, and it is important to talk about it. And why is it so important? Incapacity to work because of a mental illness, including depressive or anxiety disorders, is not a short-term one. This incapacity to work lasts several months, and sometimes are the reason for granting a rehabilitation allowance. So Professor Edvosem, my predecessor has said that sometimes there are diseases or mental diseases that in theory the employees are in the labor market, but in practice they cannot perform work for different reasons. I haven't fully answered your previous question. So absenteeism versus presenteeism. So I come to work on a regular basis because my work doesn't prevent me from being active. So this is the case with allergies, because more than 60% of people are allergic. And undoubtedly, this can be the case. A certain percentage of people with mental disorders which haven't been identified or haven't been managed properly. So maybe this doesn't translate directly to the funds of social insurance institution, but it does translate to efficiency at work and neurological diseases like migraine and pain as a disease. So when you go to work, although you're not feeling well, these are all the cases. And so all the different pulmonological diseases, the most frequent questions are the rhinosinusitis and other common diseases. And in accordance with the report for 2023, you can see a tendency for the growing percentage of these short-term absenteeisms related to respiratory system diseases. So these are just infections lasting 1 to 3 days. And you need to address a serious problem of those growing problem because of a growing percentage of these short-term sick leaves. We will come back to this issue later, but I would like to give the floor to each one of you. So now, Professor Gałązka, Dr. Gałązka-Sobotka, you as a scientist, you work on hard data, well-proven facts, to formulate your insights and reflections. But you must admit that there are certain diseases that are not visible or not reflected in data, like in National Health Fund. The different institutions have different data of, for example, the case of obesity, which is not included in the reports and still affects the labor markets. Thank you for having me. And before I answer your question, I would like to share a general reflection. As we are all here, we are well aware that health of Polish people will affect our socio-economic development. And the fact that we will stay in the 20 best developed countries, or we may even move up the ladder. But in the context of demographics, which will be discussed during the second panel, which is not very optimistic, we must be aware that the worsening health of Poles may be a reason for civilizational regression. So we must be aware that the stakes are very high, and we need to really pay attention to public health. And the renaissance of public health in the state policy is something that we scientists dream about for many years, and we postulate that the state will pay attention to and will focus on the public health. But before it happens so, because at present we have health-focused state, not we have sickness-focused state, not health-focused state. But to achieve that, we need to change the paradigm. And our international expert addressing us has said that public health is a way of thinking and not a project. And at the eve of another 10 years of the operations of social insurance institutions, we need a shift in a way of thinking, and we need to redefine the paradigm of state. And we hope that the state would focus on health from many different points of view, and obesity is a major factor here. This is a disease that has developed at a very fast pace. Obviously, the risk factor was a pandemic that accelerated the speed of its growth. But in Poland, we are still seeing smaller percentage of depression than in other EU countries. So the statistics is a bit more optimistic than in the rest of Europe, but we are catching up. And maybe it is time to make sure that we do not catch up with this trend. And we have better roads, newer hotels, thanks to being outdated and not catching up. So maybe it will be our focus, our objective, that thanks to prevention, we will be the European leader. And obesity is a good example here. This is a disease that is seen with a bare eye, and still it isn't reflected in the statistics. And my colleagues from ZUS will confirm that this disease is not as well seen as it is the case with epidemiology. And in the health-oriented state, you need to make interventions with a lack of data. And when you look through the eyes of precise measurement of morbidity in case of individual diseases and identifications, and those reports using codes that reflect certain sums of money, we need to answer the question whether the data on health contributes to effective policy and the occupational medicine we have mentioned. So we need to integrate data of occupational medicine with the National Health Fund data. And we also need to use private healthcare data, because when you are talking about prevention of cervical cancer, so it is a general truth that Poles do not have cytology, and in fact, it is the state that doesn't know how many Polish women have cytology because they are using private healthcare. So in order to have a good condition of public health, I would advocate building a new infrastructure on health data and integrating this data, because if we continue to work in dispersed, fragmented data systems, many of our interventions will not be as effective as they could be, and the measurement of efficacy will not be also full, because we sometimes say something is effective or not, and in practice, this analysis is simply not complete. Professor Brzuszkiewicz-Kuźmicka, yes, Professor, I will give you time for discussion, but now I would like to discuss another important element, physical activity, sports, being active. When you look on Polish streets, we can see that people are running, they are physically active, both in summer and winter. And then you look at the musculoskeletal diseases and its data, and the situation is not that bright. So how important physical activity is to public health. Good morning, ladies and gentlemen. Thank you for having me here, and I would like to congratulate the winners of the Prevention Award. So as for physical activity, I'm using different statistics. And as Professor has mentioned, prevention starts with a young age. 3 days ago, I attended the inauguration of the academic year, where I learned that an hour of sitting shortens your life by 20 minutes. So now 20 minutes of our life is gone. So yes, we are using different statistics, but more than 35% of children do not attend physical education classes for different reasons. And all of us represent different fields, but my field, physical therapy, focuses on something utterly different, because we are talking about prevention, accidents, and in my everyday work, I deal with young people who have had accidents, and they have temporal injuries, and they are mainly people who are under 25 years of age. And statistics do not provide treatment. And it is always one patient too many. So diagnosis also doesn't offer treatment, but prevention does. And here, from the youngest age, we physical therapists take a holistic approach to patients, and we are focusing on different types of pain, especially in people who are 65 years old and older, who suffer from different diseases, and you will be using different statistics, different measures. And the latest reports show that cancers is a civilizational disease. Cardiovascular diseases is a civilizational disease, and any field you mentioned, be it craniocerebral diseases, different statistics will be used, but you need to say from being active and differ between being active and having physical activity. Because when you are talking about motor activity, you are talking about everyday work like cleaning, cooking, shopping, etc. But purposeful physical activity is something that we focus on. So additional measures, additional activities like running, walking, and being consistent. So finding 30 minutes a day for yourself to be active. So it is 30 minutes for people who are 65 plus, but the most important thing is to be consistent.
Which later translates into the awareness. And here is the biggest problem, because we do see more and more children, people who do Nordic walking, jogging, who do biking, but with very low demography, we have more and more dynamically aging society. And here we need to redirect our activities, because we have more and more patients at the stage, at their professional stage. So how to help them so that they can continue their professional work as soon as possible, how to do it so that our society is aging but staying healthy. Yes, and statistics show that in Poland we live longer, but the years of life and good health compared to other European countries, this is a shorter period. We live long, but in discomfort, with diseases and problems which are difficult to live with. Yes, the Dean mentioned one of the most important diseases being also a risk factor for developing dozens of other diseases. So obesity, from the point of view of ZUS, obesity does not exist and will not exist. That's how it looks around the world, because there is no sick leave or any allowance for obesity. No, there are cardiovascular diseases and motor system diseases. So this is not included in the list of National Health Service or ZUS. So it disappears. Yes, if there is a lung cancer or something, then it is on the list. So, dear Professor, I know that everyone supports their own institution, but to be clear, globally and in Poland, the main killer are the so-called CVS, or cardiovascular diseases, including strokes and heart diseases. So irrespective of what we do, another killer around the world are cancers, all the cancers. Another one are chronic respiratory system diseases, POHP, fibrosis, and so on. And fourth killer are metabolic diseases, including diabetes and prevention. Let me tell it, I like the number of the Department of Prevention and Rehabilitation. I think it's crucial, because if we don't manage to do prevention, then we need money for rehabilitation. So it's good if it's in one place. I will soon become the beneficiary of Zeus, but we bought ourselves bikes in general, but these are electric bikes. So it's like a scooter. Well, you really disappointed us with the bikes. Dear ladies and gentlemen, we have 10 minutes left till the end of the debate. You mentioned a lot of important topics, collecting credible data, the labor medicine and its tools for it to become important and an essential tool to build a public health. Because when we talk about education, economics of workplace, the role of employers, so let's use these 10 minutes to form certain recommendations. Dr. Gąska-Sobotka said it nicely. We need to do everything to introduce renaissance in the health care. So let's try to talk about what are your recommendations. What should be done in order that we can meet here in some time and say that we see a different tendency, different trend, that the situation is improving, that we have small successes. Professor Jankowski, thank you very much. Thank you. First activity that we can take is creating such legislative frameworks and environment that would support creating health strategies for companies. We have various strategies of companies, but we rarely talk about policy for health management in the workplace. So understanding health needs of the population that works at certain places is key to offer them such preventive activities that will be popular, because we have various prevention programs, but their level of use is at the level of 20–30%. So if we want to efficiently reach the people, we need to understand the health needs of the population with whom we work, but also we need to create such tools and activities using modern technologies, mobile technologies, or the gamification, for example, in order to encourage people to take care of their health. For example, by gamification, so a competition between other departments in the company, because each of us has a need for small competition between each other, and then we can use it. And if we plan such a health strategy for companies and we implement activities which are adapted to the health needs and expectations of particular professional groups, then we can probably achieve the success. But in order to encourage the employers to this, then maybe through certain promotion activities, fiscal promotions, or value supporting policies at the local level, we could create individual health strategies for enterprises, especially in large workplaces. Okay, and I will be one step before the employer, because before the citizen goes to work, they are a child, a student, a young person. I would first focus on building the awareness of each of us, because let's remember that we are the ones who can take care of our own health. Obviously, we can put a lot of blame on the environment in which we live, on the institutions, state institutions, but at the end of the day, the responsibility lies on us. And we do not really use in Poland the tools which are at our disposal. Over 10 million Poles use actively individual patient account. But maybe they could use it even more frequently if we were promoting this account at the level of school already, for example, because individual patient account can be set up for a child, for a minor, within the account of the parent. And I keep dreaming about it, and that would be the fulfillment of our building the state directed at public health. So I would like to have an individual calendar of preventive examinations in my online patient account. So a calendar that would alert me in the situations when I do not do my regular checkup. So I think it's really simple from the IT point of view, and it could be very helpful. And sometimes I meet health professionals who are not fully aware which preventive examinations at which age should be a must-have when it comes to our pro-health activity. This is not so much, but really a lot at the same time, because if we think to ourselves that people who like awards, and I agree with the professor that gamification could be something that encourages us to change our attitudes. If we imagine that a person who does their tasks from the preventive examinations calendar, they can, for example, get some bonus, like a health voucher to use on some other health activities. And I believe that in that situation, Poles would really change their attitudes toward their own health. So I would like to have it in 2025, maybe. Thank you very much, Professor Gałecki. Yes, I will stay in the area of my knowledge about mental health. And I would like to raise two topics here, which are important to me. First of them is the reflection of the saying that what a young boy doesn't learn, then the adult will not know. So in cooperation with school, with education system at the basic level, because later on we can only talk about rehabilitation if there is no mental health hygiene and knowledge about what mental health is, because this will protect us from the second topic. So let me get back to the professional burnout. If we do not have the knowledge about what is the norm in interpersonal relations in the aspect of mental health, then we can easily become an unwanted object of this phenomenon, which is professional burnout. And this is not good, neither for organization or for ourselves, but also for the family. So I think that the prevention is really important, what you mentioned also, children not attending physical education classes, but also the perception of mental health. This is very important because it builds the basis to work with the people who become adults, to create new strategies with them. Professor Kuźmicka. Ladies and gentlemen, yes, I think that the most important role lies upon the employers and the workers of state labor inspection. It's better to prevent than to treat, that's for sure. But the awareness from a very young age and also the post-diploma and early education of our society is important. If there is education from the very beginning, sometimes in the past there were exercises between lessons, physical exercises between lessons. If there is good prevention program, then perhaps there will be no new diagnosis, like, for example, smartphone neck or text message thumb. Director. Yes, we are saying the same thing, more or less. So we need to emphasize the importance of the knowledge. We need to make people understand those things and so on. Generally, we were talking again about the education, so health literacy. The awareness of how to be healthy is the basis, because if we do not have it, then no one is going to do preventive examinations, because they will not understand what it is for. No one will understand why they should not smoke or drink and do sports if they were not taught about it. Nobody will vaccinate against dangerous infectious disease if they do not know, don't understand why. So we cannot replace the education of our youth with a vaccination day once a year or some vaccination campaign before the autumn season. It's not how it works. Prevention is the activity that needs to be regular, and it takes years, and then we see effects after a long period. Of course, we need to fight the previous negligence, but if we want our children or grandchildren to be a healthy generation, then we cannot wait for them to be 15 and have the first symptoms of mental disease, obesity, of motor system diseases, because then it's too late, and we are going too late to waste that generation. Okay, the time is up. Thank you very much for sharing your knowledge with us. Madame Gałązka-Sobotka mentioned her dream. I would also dream that there is time when the decision makers listen to what you say, to what you suggest, so that it translates into particular decisions. Thank you very much for your attention. I think the meeting was very interesting. Thank you. Thank you. Thank you, dear editor Iwona Szymala, for moderating this panel, and I would like to thank the panelists for the participation in the discussion. I will invite you to a break in a minute, but before that, I would like to encourage you to visit the stands of the partners of our event, which are there in the hall. Visit also a small exhibition of pre-war posters related with social insurances and with the preventive activity. And at the same time, I would like to thank the Poster Museum in Wilanów for providing us digital copies of the posters. And we are meeting again after the break. Thank you very much.
Ladies and gentlemen, let us resume. Now we are having the second panel concerning challenges in demographics. Apart from health, demographics affects national security system, society aging, longer working life, and economic migrations are some of the demographic trends which are seen in the structure of the insured who are using the ZUS. So even the older people who want to extend their working life in the years up to 2023, the workforce comprised 53% of people who have used rehabilitation allowance. So the next panel will be moderated by Alicja Defrytka, the author of the numerous projects and publications. So now it is time to give the floor to the moderator and the panelists. Good morning. I'm very pleased to welcome you, and I'm pleased to welcome our panelists. We are talking about demographics, and the panel is attended by Dr. habilitowana Agnieszka Chłoń-Dominczak, professor of Warsaw School of Economics, deputy rector for science, and the head of the Institute of Statistics and Demographics at the Warsaw School of Economics, and also the president of the State Government Population Council. We'll later explain what the new body is. Dr. Tomasz Lasocki, assistant doctor at the Warsaw University of Technology. Dr. Elżbieta Ostrowska, president of the Polish Association of Pensioners and the Disabled. Professor Paweł Wojciechowski, the economist and the president of the Program Council of the Institute of Public Finance. And Dr. Kamil Matuszczyk of the University of Warsaw Center for Research on Migration. So our panelists have a different scope of interest, and although we are talking about the demographics of the aging society, there are many different aspects that affect the trends, and they compound together. Let us start with Professor Agnieszka Chłoń-Dominczak, who will present where we are heading in terms of the aging society. I'm running the project called Interesting Numbers, so we are going to mention numbers. Maybe we are not the oldest society in the EU, but we are the fastest growing older society in the EU. In order to present where we are, in 2007 and 2008, when the Lehman Brothers crisis started, young people aged 18-29 were more than people aged 60 plus. Now, people aged 60 plus are twice as many as young people in the youngest age category. So let us start with where we are standing now and what is the structure of the demographics in Poland, how it will affect the labor market, because this is the key question for us. Where we are. Starting in 1990s, we have had a low birth rate. So smaller and smaller children are being born. We have had a rising trend for a short time, and it was not because of a rising birth rate, but because we have seen women who were born in the times of baby boom, who were giving birth to their children. But now we are seeing the dramatic changes in Poland and the EU, because any crisis, any time of uncertainty, people decide to have children later. So the number of births in Poland is at record lows, and the Central Statistical Office shows the declining numbers year on year. And this reflects a serious problem that should be paid attention to. It is compounded with another demographic process, which is related to the fact that people live longer. During the previous panel, we have touched upon this topic, and although people live longer, they are not necessarily in good health. But this is a regular civilizational trend. So the fact that we live longer means that in general we are healthier, and also the age structure of the population is changing. Medium age is changing, so the older people are growing in numbers, but we are still having some people who are representatives of demographic booms. So we have a post-war baby boomers, and then baby boomers of 1980s. So the population trends are changing steadily, and these changes are more visible in Poland than in other EU countries. Also, the migration trends affect the demographics of Poland, but it should be emphasized that until after Poland's EU accession, so up to 2012 or 13, we were a country from which people migrated rather than to which people migrated. But the results are such that we are a growing number of people of retirement age, and we are also have shrinking labor force. Year on year, we can see a decreasing number of people who can take up work. So we need migrants in Poland, which is well reflected in those statistics. However, the characteristics of a labor market also changes. So unemployment is not an issue, but the growing number of vacancies is an issue. Is it going to grow? It depends on several factors related to the labor market. So we still have a certain potential, but we are still observing a growing number of migrants, immigrants who work in Poland. But the labor force deficiency will be an issue. So maybe it will be time to look for more productive forms of work, maybe automation or artificial intelligence. All of these trends are in place right now, and they affect the labor market. So with a shrinking human capital, we are looking for improved, boosted efficiency, and we are looking for other solutions. So these are the challenges we are facing. And going back to the topic of our conference, prevention and rehabilitation is extremely important here. You need to take care of your health, because this is a main factor of human capital, which contributes to our efficiency, to our presenting, to not going on sick leave and not using allowances. We should also make sure that when you are a manual laborer, you need to use certain solutions that will protect your health. And the National Labor Institution conducts extensive research into making life easier for us by making work well harder. So we need to encourage people to stay on the labor market and to be effective, because people who are pleased with their work, even if they are in a retirement age, they decide to continue their work even beyond the age of being a pensioner. So I was to ask about public finance, but you have mentioned migration. So the foreigners and their contribution to Polish labor market. According to data compounded by ZUS, at the end of quarter two, we have 1.2 million foreigners working in Poland. So this is roughly 7% of the labor force. So seven employees out of 100 come from abroad in Poland. So their numbers will be growing probably in order to save our labor market, because the age structure is changing. And unemployment is not an issue, but the shrinking labor force is. So maybe the integration of foreigners into the labor markets will be the solution. Good morning, ladies and gentlemen. I believe this is a minimum value, because you are talking about people who are working legally, but we have a gray zone, hundreds of thousands of workers who are not included in the official system, or seasonal workers who work under crews. So this may be 10% of foreigners who are active in various forms of employment in various sectors of. And these are people of not Polish, of an origin different than Polish. So many foreigners will be willing to come to Poland, but the question is whether, as part of the migration policy, I have attended a team at Polish Academy of Science who has developed the migration strategy, because there are certain discrepancies between individual ministries in Poland because of differing interests. And we are seeing a great interest in the Polish labor market. And employers are also willing to employ foreigners. So this is true about agriculture, construction, and care services like hospitals and healthcare institutions. Well-qualified staff members are also welcome. And I would like to pay attention to another topic. We are talking about the labor market in Poland, but we should also think about migration from Poland, so outbound migration. So it is no longer the case that hundreds of thousands of people leave Poland, but also, Poland is a leader in terms of delegated workers. So we are still seeing some people who work abroad. So during my dissertation, I have focused on seconded staff members, for example, in Germany. For example, care services is a sector that is very dynamic. So there are hundreds of thousands of people who leave Poland every year seasonally or temporarily on secondment to Germany, for example. And the scale of this trend is growing. So we have temporarily outflux of Polish laborers and influx of foreigners into Poland. So we assess that 1 in 10 staff members in Poland come from abroad.
These numbers are really impressive. Those migrants currently save our labor markets. If it hadn't been for them, it would be probably more difficult. But also, as we know, the whole demographic structure has impact on public finances. A very important topic. And recently, there was also a controversial speech of Minister Nowent, which called ZUS a financial pyramid. You probably heard about it. Let's say it is ZUS insolvent, taking into consideration the aging society, more and more elderly people, less people entering the job market, the labor market, that the system is going to be inefficient. Is it really a financial scheme, financial pyramid? Thank you for this question. I see. Looking at the people from the audience, I treat it as a joke, but as the minister says something like this, people start to be afraid that the pyramid is going to collapse, because the financial pyramid must collapse at some point, not only because it's illegal, but financial pyramid, whose mechanism is selling various applications and then taking money from already existing customers, is an element of a pyramid. It was globally done also by one of the MPs, and who was recently arrested, but also Amber Gold. But we have certain security procedures, and we function like banks. We give credits, and then we have deposits. There is never the capital adequacy to the level of 100%. It can be 8, 10%, so that's how it looks in financial institutions. ZUS is a financial institution with special purpose and of social trust institution, but banks as well. And I wrote a text together with another professor, a discussion or an attempt to explain certain obvious things, and we said that it is like a demagogy pyramid, because the whole mechanism of ZUS and the functioning of the common system is about the repartition of the income of employed people who pay their contributions and the allowances which are paid out. But the circulation of the money, the flow of the money based on the repartition of the income in real time. So a certain part of people pay the money, and then we pay it out to other people. That's how it works, similarly to a banking system. So that's how we can talk about it, looking at the number of people who are employed and people who receive the benefits. So that's how it looks. And there is also the Holy Grail. And the Holy Grail of the pension system, in which the amount you pay will be later the amount of the pension that you will get. And this Holy Grail is a certain element of the system which enforces center equivalent of the system. So on an individual, when it's individual level, then it goes to the level of the funds, and when we are switching from the old to the new pension system, and it stabilizes. And according to the forecasts prepared by ZUS, in the GDP percent, only in the GDP percent, the deficit dropped from 2.42% to 0.02%, and the efficiency of ZUS rose from 68 to 85%, and it's going to continue growing. So, to put it shortly, certain numbers are dropping, but at the cost of the benefits, because that's how the Holy Grail of the pension system works. But it doesn't mean that the individual part of this vehicle has impact on the redistribution in the system. I don't see Asia Stachura here, but there she is. She used to say that redistribution between systems is much larger than the one within the system. The one within the general system is quite small compared to the redistribution that takes place between various subsystems of the current system. So comparing a demographic pyramid to, let's say, financial pyramid, or the one which allegedly ZUS is, or it's like comparing to a house pyramid, or comparing a chair to an electric chair. I'm not talking about a wheelchair, but about an electric chair. It doesn't make sense. It undermines trust to the system. And when Madam Minister said 2 weeks after that, that's what it was about, to start a discussion so that people want to work longer, and the government is considering increasing the retirement age. So then I'm wondering, we have a financial pyramid that needs to fall but stay in the system. It definitely did evoke a discussion and emotions, but that was not the goal, I'm sure, because I don't think you can encourage people to stay on the market, convincing them that it's a financial pyramid, so they might never get their money back. This is a very dangerous statement and very harmful. When I was starting my project called Interesting Numbers, one of the first numbers that I wanted to explain was the number. What they were saying that increasing the retirement age to the age of 75 means that people will need to work till death. So that was 67 years until death. And this is also very risky, because how can we encourage people to work longer if we try to convince them that 67 is death? When we know that the lifespan is getting longer. Women live over 82 years, men almost 75. Throughout the last 30 years, the lifespan got longer by 7 years. So how can we encourage people having such wrong models going from the top? How can we encourage people to stay on the labor market, to be active longer? So that they can disagree with such brutal comparisons. So let's ask Madam Professor, PhD. Thank you very much. Dear ladies and gentlemen, I represent Polish Association of Pensioners and People with Disabilities, and the association itself associates elderly people and people with disabilities. My interest focuses on problems of people who have finished their professional activity. About the problem of a longer work for elderly people and the conditions so that they want and they can work longer. The topic is quite dynamic, especially among my younger colleagues, who often join the association with the narrative that they finished work not really fully willingly, but because of the conditions. And therefore, I will share a few reflections about it. But before that, I would like to refer to the demographic forecasts, because demography is brutal. We are aging as a society, and also older people are getting older because the baby boomers are now entering the older age. So the forecast for 2050-2060 show that 40% of society will be elderly people. Is it a burden, or is it also a certain value that can be used in economic processes? I think that to answer this dilemma, we can mention the silver economy, so the economy which is devoted to the needs of the seniors. And I think that it's very important, because throughout the last years, the older we get, the more our perception changes, the perception of our needs, our capacities. This is not anymore the passive older consumer who does not work and does not play a big role on the consumption goods market. They are still active in various areas of life. Getting back to the longer professional activity, last years have brought positive changes of this trend. Currently, around over 850,000 people have right to retirement, but they still work. This is a lot, but not much in comparison with around 8 million of pensioners. And elderly people, in order to work, they need to want and they need to be able to work. Why they do not want very often? Let me refer to the first part of the meeting today, because very often their health state is unsatisfactory, and they hope that the free time during retirement will be time for them to improve their health. Whether it is so, that's a different story. But prevention definitely did not work, at least in terms of this generation of the older people. Usually they have to stop work due to family obligations. The traditional family model is disappearing, but there is still this imperative that a grandmother is taking care of the grandchildren because there are no other possibilities of childcare. And very often, also, employees reaching the age of retirement does not feel any incentive from the employer to stay longer. Already earlier, before the age of retirement, they are often marginalized. They do not participate in trainings because why invest in an employee that is going to stop working in a few years? So there is a situation of gradual isolation. Those employees feel unwanted, unproductive in the team, and therefore many people decide to quit earlier. And working longer work is not only an economic element. This is not only about income. This is something very important. It's the feeling of social relations, of a certain agency, importance. A person who retires loses a lot, loses a group of... The group of close friends decreases with age, and the feeling of social marginalization and loneliness appears, and this can be very dangerous for health, even sometimes more than, for example, cardiovascular diseases. So I think that the employers, and this results from the relations of people who retired recently, the employers usually prefer the model of an active, young, active, risk-taking person who likes innovations. So this model prevails over the one related with a older, wiser person with a lot of experience. And I think that the future of the labor market is appreciating both the youth and also the maturity, so creating mixed teams in terms of age, and the research proves that such teams can be very efficient. This is certain added value resulting from combining the young energy and entrepreneurship with the wisdom and experience. Why entrepreneurs, knowing the results of the research, still do not take such activities to create such mixed teams? I think this is because it's a bit like an idealistic model, because in that model, young people want to use the experience of the older, and the older want to share their experience. But in practice, very often it leads to conflicts and to cooperation. However, the perspectives of the growth of the labor market, of increasing the length of work of elderly people, seem to be related with this solution. And a few more words about the silver economy. Well, let's do it in the second round. Okay, thank you. I think that employers will be forced, and this is not only about them wanting to hire the younger employees and give up the older ones. I think it's going to be the new normal. They will be forced to create the diverse teams and to maintain qualified, experienced, older employees on the job market, because there will not be enough of the young ones that we mentioned, because there are less and less of them entering the job market. And referring to the discussion of longer work, staying longer on the labor market, when I think of the retirement age, I think that we live longer in good health. At the current retirement age, at the level of 60 years, this is not the same 60 years so that 20, 30 years ago. We remember the film 40-latek, 40-year-old. Now it's not the same 40-year-old that 30 years ago. Current 60 is like 50. So a lot has changed. So I think we should use positive messages to encourage people to stay on the labor market. And now referring to the reform, whether the incentives will be sufficient or not, whether the incentives are going to be enough to keep us on the labor market. This is a question to Mr. Lasocki. Or So certain system changes will be required. The government says openly that they will not increase the retirement age. But the question is whether that's for sure, or maybe there will be other incentives or changes needed in this retirement system, so that it all works well and that people really remain on the labor market longer. Hello, thank you for this question. Because, well, I am a lawyer in order to do some traffic in my business and say that changes are needed. But whether they are really needed, I will leave that to you. So it's very good that we talk about demographic changes, among others, in the context of prevention and rehabilitation. So thank you very much, Madam Director, for organizing this great conference. And also, thank you very much for inviting me, because from the perspective of demographic challenges, the prevention is really super important, because it's integrated with in the whole policy. So managing the situation that we have, the demographic situation, and the prevention and rehabilitation, on the other hand, its goal is to maintain this capacity so that our economy still functions despite the demographic changes. But on the other hand, an element of the continuous education is lifelong education is very important. And we can mention many other components that can help us manage the situation. We are not the first in the world, because other states are facing or faced already the same problems. Some of them managed better than others. But is our system prepared for the demographic changes, the changes that you mentioned, like the need of migration, the need to remain active, and the Holy Grail that was mentioned? Is it all coherent in the system from the legal perspective? And let me tell you that this is not necessarily the case, not on each element. Therefore, the need of change in the system. Let's start from the incentives to work longer. First of all, we have big homework to do to drop the elements that encourage us to retire earlier, because the government says we will not increase the statutory retirement age. Those who know me know what I think about the retirement age, so I will not repeat myself. But whether the effective retirement age in Poland is going to move? No, because we are the only system in the world. I don't know all of them. But there is a really big bonus for retiring early, so at the age of 60. The increase of the retirement, of the pension, when you retire earlier. There is no such situation around the world. So we really changed the system of the contributions, which should encourage to continue. And if any woman decides to work longer, let's say till the age of 65, she retires, and she keeps working, then there is a probability the part of the contributions that she was paying between the age of 64 and 65 is going to be lost. So we really need to analyze the system. People will retire, and the problem is going to get worse when we reach the main risk in the system, that is going to lose its entrance character. My vision is that through maintaining low retirement age for women, the great majority of women will be at risk of getting the minimum pension. So the award is known. Most of the women will get the minimum retirement, irrespective of what they do, because probably they will retire at the age of 60 years. Let me add that 80% of those minimum pensions is for women.
Yes, and we are talking below minimum, yeah. And I'm saying that we'll have more than 80% of people. Professor Turewicz made some calculations. So if you know that the reward will be the same regardless of how hard you try, so why do you need to try? So the women should have 20 years of premium and non-premium experience, and that's all. And there are still certain solutions that will make sure that the more you put, the more you will take out. So what I would change, first of all, I would make sure the system allows for having the minimum pension level, the sooner the better, and then to add on that, build on that. So secondly, I would close the incentives that push you out of the social insurance system. And the third question is integration. So it's both Poles who live, work in the system. There are so many exclusions and leaves. So as a result, an average entrepreneur in Poland had so people who are active, so are sole entrepreneurs, pay lower pension than just an average staff member. So you need to streamline the system and to think about it carefully. We are running out of time, so maybe some more question. And then the question to Paweł Wojciechowski. Do you agree with your predecessor that you do not need to raise the retirement age, but you need to introduce changes? And it hasn't been said here, but we've been talking about different elements in the construction of a system. So, Paweł, do you agree with it? What changes should be introduced? Well, it's difficult to disagree. First of all, Tomek is a birthday boy today, so you cannot disagree with him. It's his birthday today, and together we write interesting articles like about Winnie the Pooh, who would like to be willing to work as hard as he is unwilling to work. We've been discussing incentives that would promote longer retirement age, maybe replacing the contribution, disability pension contribution into the retirement contribution, or just having a different category of the contribution in order to make sure that all the pension contributions are counted towards the retirement. So I do not believe that raising the retirement age is a systemic solution. So the key question is whether you should use parameters towards the system and individual subsystems, because each change, like raising the retirement age, will even make the gaps bigger. So the key question of a reform is to make sure that people pay the contributions, and all the contributions are counted towards their retirement, regardless whether they are teachers, miners, or farmers. You need to calculate. So you have a preference. You do not need to pay 19.52% contribution of your wage. And in fact, some people pay much lower contribution and still obtain the same retirement. So distribution is about what you pay and what state budget pays to your contributions. So the retirement age scheme is a question of political debate, and it is the ministers who decide about it. So in the interview, you have said, yes, so there are many interest groups who obtain additional benefits, and I'm not talking about farmers not obtaining preference or policemen. But the question is that the system is transparent. When you raise the retirement or you change valorization, it impacts on the redistribution, and it just makes the privilege even more strong. So this redistribution effect is reflected in social injustice because some people pay smaller contributions than others. Now I need to stop you because we are running out of time, and if we are not changing the system, and of key importance are changes you have mentioned, and encouraging people to work longer. So what skills will be? Just let me finish my thoughts. Streamlining, then effective retirement age, and removal of minimum pension payments, and encouraging people that the longer they work, the more pension they get. So this reform would be a systemic reform and not a parametric one. I hope it will be taken into consideration in the public discussion. The labor market is changing. What skills will be needed in order to stay longer in the labor market? And having in mind the aging of society, different skills will be needed. Madam Professor, what do you think? Well, I believe that people who are coming close to retirement age will not reskill easily. They would continue their work in their own profession, and what they need is just some skills related to new things or novelties in their profession. So lifelong learning, it's not that you are 50 plus and then you stop learning, or you need to suddenly obtain new skills. You just need to be consistent. And you should observe the labor market because it is changing rapidly. Let me give an example of some time ago, there was Equals initiative in Poland, as part of which innovative projects were conducted in order to include people in the labor market or in the society. So it was implemented by Solidarity in Gdańsk. And, for example, people who designed ships were trained in computer-aided design skills. And because all graduates, young graduates of ship designing were just emigrating abroad, and those who worked without using computer skills have established really efficient. So they continued their work, and they just got some new skills that they didn't get during their initial training, and it did work. So this is the question of making sure that you're using and you are keeping up to date your skills, and that you develop your skills. And this is how employers should think about their staff members. They should invest in mentoring, and they should make sure that peer learning is also in place. We are running out of time, so I hope you will forgive me that we will have just the last round of questions concerning integration of migrants to the labor market in Poland. Are there any particular professions that require the permeability of individual channels in order to make sure that people with specific specialities stay in the labor market? Are there any specific solutions? Let me emphasize one more thing, because this conference focuses on prevention, and I was saying that the labor market is willing to use people from abroad, but this is the easiest solutions to be adopted, and you will see the results within a couple of months. But let us remember about the prevention among staff members, because people without any skills come to Poland mainly, and you should pay attention to the prevention and health safety of these staff members. So, for example, I spend a lot of time with people, seasonal workers from Ukraine who pick up apples in the summer. So I'm spending a lot of time with them in the summer. And the ones who come here, they work very hard to make money quickly at the cost of our health. But when you want to have people from abroad working in our labor market, you need to integrate them. You need to take care of their well-being. So we are just offering them legal job, and that's it. And we lack systemic solutions to do that. I believe that several strategic instruments will be developed, like migration strategy that has been mentioned before. I believe that we need staff members in all business sectors, and we need qualified workers like bricklayers, plumbers, and highly qualified staff members, professionals. And we are seeing that the foreigners are coming to Poland too. And just the last word from Dr. Elżbieta Ostrowska. How do you perceive the opportunity for including senior citizens on the labor market and to encourage them to stay professionally active longer? What are the benefits for the economy of senior citizens working longer? Well, we do not know how the labor market will look like in 5 or 10 or 15 years, how artificial intelligence will affect it, what new jobs will appear and which jobs will disappear. So when we are talking about encouraging the senior citizens to stay in the labor market, well, this is the question of being open to change and being open to lifelong learning. Well, what benefits are related to being professionally active for longer? Well, you can see only benefits, because they are productive, they are more active in life, they are committed in different areas of life. And this is an element of prevention, because those who are professionally active also take care of their health. Well, it's difficult not to mention silver economy, which will satisfy the growing needs of the elderly and the disabled, but will also be a sector that offers new jobs. And in accordance with some forecasts, it will stimulate growth and will prevent a recession. And last but not least, I would like to say that longer professional activity of the elderly is related to their reskilling. So people who are 60 or 65, they still are engineers, lawyers, and they do not need to re-qualify. It's enough that they update their knowledge, because, you know, sending all the elderly to career services is not a good idea. And I believe that staying open to upskilling by employees and employers, so not leaving out the elderly or older staff members from training. So it is both on the part of employers and employees to make sure that they are active, that the older staff members are active. During the previous panels, we have talked about health prevention and the implementation of these programs, and it is happening because health policy is a new school subject, for example. So we'll see whether decision makers will listen to these scholars. So what is the new body you are a member of? So National Council has operated for more than 20 years. So Professor Strzelecki founded a National Population Council. So I believe it has operated for even longer than 20 years. And this body is composed of demographics experts and representatives of a government. So the council has been rejuvenated, its composition has changed, and together with the leaders of this council, we are redefining its task, because every year it prepared a report on the population, and now a lot can be read about the population structure, but it is very important to reinforce dialogue between researchers, because we have a lot of research, a body of research. For example, I coordinate health and aging and retirement research in Europe, which provides knowledge on how the 50-plus generation is being transformed in Poland and in Europe. And the conclusions we draw from research call for just the implementation of these conclusions into the policy, family policy and the labor market policy and the social security policy or long-term care policy. We are having more and more people who are 80 years old and older, and long-term care is still underfunded in Poland. So if we manage to use the government population council to form fact-based policy, it will be a great success in Poland. I'm not an optimist, but I want to believe that you can combine the two worlds, and even the bridging pensions can be a great solution, which have shown that you can change the system, you can limit access to early retirement, and the labor market hasn't suffered because of it. And it has appeared that you can work for longer, and this is a very good example of the fact that when you explain things and when you stay in dialogue, it is effective and it works. I'm a proponent of having an optimistic outlook, because if you assume that you cannot do it, you will not do it. And if you believe that there is a chance for introducing change and You can make people stay longer in the labor market, and if you believe that the government will use good ideas, it will hopefully materialize. I'm sorry for taking too much of your time, but as you can see, the debate is so comprehensive, and you could have a separate debate concerning each question we have discussed. So I would like to thank the panelists for this very interesting discussion. Thank you.
And the moderator was Alicja Depatica. Thank you very much to the panelists and the moderator. And now I would like to invite you to another part of the conference, but in a different form. These will be breathing exercises conducted by Agata Kita and Magdalena Trojanowska from the sanitarium of the Wieliczka salt mine. So you can have a chance to use prevention in practice. Hello, we came here from Wieliczka. My name is Ivan. I am a physiotherapist with Agata Kika. We wanted to present you a modern approach to breath rehabilitation. We would like to encourage you to do breathing exercises, which we carry out in our resort 135 meters under the earth. Let me make a short introduction related with respiratory system diseases that we encounter mainly in our resorts. This will be asthma, allergies, various pneumoconiosis, and other upper respiratory system diseases. So everything that we're exposed to due to the poor quality of the air. Our most common patients will be children, people who work with their voice, and people who suffer from various pneumoconiosis, but also people who suffer from chronic upper respiratory diseases. We have various types of breathing exercises. Let's start from drainage exercises. But first, let's all stand up, because this part is supposed to be active. Okay, first of all, let's base your body on the heels. Let's straighten our spines, chest to the front. Let's start from circling the shoulders to the front. 7, 6, 5, 4, 3, 2, 1. And then backwards. 5, 4, 3, 2, 1. Put your legs to the sides. Move your hips gently. Keep breathing. Put your weight from side to side. Base one of your feet on your fingertips. Let's turn it so that you move a bit your joints. Another foot now. And now intertwine your fingers of your hands, and let's rotate a bit your wrists. Now you can take a seat, but this is not the end of our exercises. As I said, let's start from drainage exercises. These will be the exercises that concern all of us, because they are the key in to providing health to the whole respiratory system when we want to purify it from all the discretion that of all the secretion that we have inside them. And first basic exercise in order to remove a bit this respiratory system will be just simply a deep breath. So straighten your back once again. If you can, do not lean back on your seat. Let's put your hands on your knees. And let's take a deep breath with your nose and a calm exhale with your mouth. And once again, engage your chest, your abdomen. Inhale, exhale. Once again, inhale, exhale. In order to help the secretion exit your system, we can pick some positions. So let's pick one that is easy now. Place your forearms on your thighs and then take a deep breath and exhale with your mouth. Inhale and exhale. Once again, inhale and exhale. I think the next way of evacuating the secretion is very known to you, and this is just patting on your back. I work with a patient, I tend to do it. If you want to try it at home, do not pat at the bottom of your back because you can irritate the kidneys, and do not do it in the middle of your spine because when you hit against your bone, it's going to be very unpleasant. You can do it even to yourself. So let's straighten our position again. Let's put your hands to in this form. Let's start from lower ribs here on the side, below the chest. So try to put it on the side, not in the front, so that you do not injure your stomach. And now we need a certain vibration factor. So let's add a loud ah. Let's work with our vocal cords as well. And let's do it strongly, bravely. Great. Now let's move to the upper ribs from the side. Hold your hand folded like this. One arm up. And once again, keep clapping and say aloud ah. Yes, let's warm up a bit the vocal cords. And another side. Great. The upper chest and ribs. Here we can do like this, a semi-fist. And let's keep clapping and keep saying ah. You are better than our patients. Great. Another exercises will be with exercises with prolonged exhale, which will help us to increase the capacity of our lungs. And we will also have we will be putting a certain obstacle to our inhale. For example, if I hold both ribs on both sides, so this diaphragm tract, but you can do it also on your own. So cross your arms on your chest, try to put your hands on your shoulders, and while you inhale, give yourselves a strong hug. So tighten your arms and take a deep breath. So try to interrupt this to create some resistance to your inhale. So once again, inhale, and during the exhale, you loosen it. Once again, inhale and exhale. And now the diaphragm tract. Put your hands on lower ribs, on the sides, not in the front. And while you inhale, press the ribs towards the center and downwards. Once again, inhale and slowly exhale. Once again, inhale, squeeze your ribs and then loosen during exhale. And once again, inhale and exhale. Great. And now we will move to a very important topic, which is respiratory rehabilitation with back pain symptoms, which probably most of us experience, maybe even all of us. And now I give the floor to my colleague. Yes, hello. Patients with back pain usually are not related with pulmonology rehabilitation, but very often their problem is not only tense back muscles or weak abdomen muscles, but a wrong pattern of respiration and wrong functioning of the diaphragm. As you see in this picture in the front, the diaphragm is attached to all the muscles, and if it doesn't work properly, then the ribs and the chest and the lumbar and thoracic part can be at risk of dysfunctions, just like the digestive system, respiratory, cardiovascular system. So indeed, the diaphragm, which is the key respiratory muscle, is also very essential in the functioning of the whole body. So the respiratory re-education is very crucial when we suffer from back pain, which is mainly treated with some back exercises and so on, and we do not talk enough about the diaphragm. This year, WHO focused on the role of physiotherapy in back pain, especially the lumbar section, and this is the most common problem of people who sit at work. According to research, it's one of the main causes of sick leave after pregnancy. We know that after the COVID pandemic, the number increased significantly. And now we should think about the role of pulmonologic rehabilitation in all this. Working with diaphragm is a very long topic, and we could talk about it for hours. But it's very important that very often we do not really engage our diaphragm. We breathe as we like, so in order not to get too tired. But unfortunately, we have to get tired a little bit to engage the diaphragm so that our breathing is more active. So the first exercise to activate the diaphragm can be as follows. We sit down on a chair. We place our forearms or our hands on our thighs. In this position, we block our chest in the upper parts. So we block our shoulders, so we do not add any unnecessary and unwanted respiratory movements. And we focus on a slow inhale and exhale with our inhale with our nose and exhale with our mouth, pushing all the air in the abdomen, but not in the lower abdomen, but just below the sternum, just below the ribs, as if we wanted with the inhale to push all the air under the chest and pull the diaphragm up. This is definitely not easy, but and unfortunately we don't. Most of us don't know how to do it, and that's where the problems appear. It would be best if you stood up and please lean on the chair in front of you, as if you were very tired after a long walk. Okay, if you don't have a chair, I'll give you mine. So let's lean on the chair in front of us and move backwards a little bit with your feet to generate some space between your abdomen and the chair. And in this position, try to get some air to push as much as you can in the lower ribs. And as you exhale, try to make it as long as possible, saying the sound S. Till the end, slowly. Inhale. Great. Very good. The next thing is learning with a lower rib tract. As you can see here in those pictures, with the correct respiration, the diaphragm goes lower while you inhale, and the longer part of your chest should extend. And as you exhale, the diaphragm goes up as if automatically it pushes the air out, and the lower ribs should decrease their width. And now, in order to learn to activate your diaphragm while breathing, we are going to learn to breathe with the lower rib tract. So put your hands on your lower ribs, your thumbs at the back and forefingers in the front. Make sure you are holding your lower ribs, not your hips or your abdomen, where it's soft, because we do not want to work with our intestines. Make sure that you are holding your ribs. If it's not comfortable for you, if you cannot hold yourselves like this, then you can do it in a different way. And now inhale with your nose, trying to actively push your hands with your ribs, as if we wanted to extend the chest as much as possible, as if we were wrapped with scotch and wanted to tear it apart. And let's press the ribs gently inside and downwards, as if we were squeezing out a toothpaste from the tube. Good, very nice. Gently and till the end. And now maybe it's going to get funny. Oh, if you like it, well, then it's already funny, then join us in our resort. Okay, now let's inhale once again with lower rib tract, and with exhale, we will be saying, for example, P sound, and we will separate our exhale into a few parts. So we will be doing like this. And with each P, we are pressing the ribs gently. So you accentuate the ribs with every air shot. So it's one exhale divided into numerous parts. So with the exhale, we are saying P. Very nice. And now, if you wanted to blow something away from the table with each P, so let's give it some energy. Inhale. Very nice. Please join us in our spa. Okay, I'll be faster because my time is almost up. Another essential thing in the whole respiratory rehabilitation and rehabilitation of lumbar spine pain is the incorrect posture are due to a sitting lifestyle. So now my colleague is going to present you how a typical person working at a desk looks. After 3 hours of work, 10 phone calls, you can take your seat.
So what is important? You need to educate people. You need to educate people and employees how to sit properly, because this is how you sit when you do not focus on it. So straighten your back, move your head back. It should be you usually lean forward in order to look at the screen, and you have your hand on the mouth and you lean your head forward. So move your head back, straighten your back, press your feet on the floor. So do not bend. Have your feet firmly standing on the floor. Pull your shoulders towards shoulder blades towards the spine. So pull them down. And imagine that on the top of your head you have a bowl with water, and you want to have it as high as possible. So just imagine as someone is pulling you through the top of your head. So this is overcorrect posture, but this would be great if you sit like this at least once in an hour for a couple of seconds, just to activate your muscles and to remind your body how to sit properly. And then you take 3 breaths, and you just you just breathe in with your lower ribs and then relax. So you just let your shoulders go back, but you are not staying in this position. And you just relax. So 3 times. Breathe in and out. And this is what you should do as frequently as possible. So it should be the first thing you do when you wake up in the morning. So when you wait for your water to boil for your tea, and then flexibility of chest, sitting long hours makes your chest contract and it's not flexible anymore. So the first exercise, sit in a proper position and pull your chest forward. So without moving your hands or legs. So even your colleagues will not notice that you're doing anything. You just pull the chest forward. So have your breasts forward, and then inhale, and afterwards exhale and relax. And 3 repetitions. So as if you wanted to push something with your chest in the air, and then move back. Excellent. Now let us add hands. So put your hands in front of you. Join your palms. And you are opening a book. So you're opening your palms like a book. And with inhale, you inhale with your nose, and you put your thumbs towards your back. So those of you who can open your hands, you can do it. Those of you who have colleagues nearby, you don't do it. And with exhale, you are just giving yourself a hug. And say something nice to yourself. So inhale, open your chest, pull your shoulder blades together, pull the chest forward, and exhale around your back and hug yourself in. If you cannot touch your back when you are giving yourself a hug, you should feel concerned. As for the respiratory tract rehabilitation, we have hospitals, outpatient clinics, ambulatories, and sanatoriums, and obviously prevention and education. Although when you look at the scope of the challenges faced by society, this is not comprehensive. We represent the Wieliczka salt mine resort. We offer respiratory rehabilitation 130 meters underground. And please remember to take a deep breath. Thank you. I've told you that respiratory exercise would greatly contribute to prevention. So a big round of applause for our presenters. And now it is time for lunch break. And I strongly encourage you to visit stands of our partners and the exhibition of posters from the interwar period. Thank you. Dear ladies and gentlemen, welcome after lunch break. And now it's the last part of our conference that will be launched with a power speech by Dr. Engineer Natalia Schmidt-Polończyk of the Mining Academy in Kraków, entitled Educating About Safety and Health Protection. This topic is treated very lightly and is usually considered boring. And Dr. Schmidt-Polończyk promotes health, and she will tell us how, in a user-friendly educate about these topics that will not be a mere discharge of a responsibility to educate about health, safety, and health protection. Madam, the floor is yours. Good afternoon, ladies and gentlemen. My name is Natalia Schmidt-Polończyk. Let me add, I'm a scientist at Akademia Górnicza Hutnicza, and I specialize in fire safety and rescue evacuation in road tunnels. So the topic of educating about safety is very close in me because I have worked in this area for 15 years. And initially, I believe I didn't do it properly, but thanks to my professional development and acquiring new skills, undergoing numerous training, have resulted in the fact that I'm willing to share my experience and knowledge. And talking about safety, even being a small girl, I was a good observer. And my dad was a chief of a fire brigade in an industrial company, and he was responsible for chemical rescue. So once he came back home, he talked about accidents, about the nitrogen plant he worked in. In 2018, there was a call that there was a chemical leak in the plant of nitrous, and there was one staff member died as a result of the accident. And my father is retired now, but when I am now thinking about teaching and training, it is worth asking two basic questions. How do you memorize things, and when do you memorize most? And now it is time for a small quiz which shows a general tendency. How much can you remember once you read some information? I'm not talking about a book or a criminal story, but I'm talking about education. Once you read, how much of this information do you retain? It's 10%. Once you hear something, it's 20%. When you see information, you retain, yes, you're right, 30%. But in education, a picture is worth 1,000 words. But once you hear and see at the same time, just like it is the case right now, or during lectures or training, how much will you retain? Yes, 50% of information. Yes, 20 plus 30 is 50. And once you talk or repeat, once you have to say something, so you need to acquire some knowledge and when talk about it, how much information will you retain? It will be 70%. And once you do something on your own, how much of it will you remember? So the perfect condition is 100%, but it happens very rarely. So in general, we say 90%. And this is not something new, because in the 19th century, Benjamin Franklin said, "Tell me, and I will forget. Teach me, and I maybe remember. Engage me, and I will learn." And the first pillar of good, effective communication is commitment. And in all situations, educational situations, I take part in with students, be it training or mentoring, tutoring, working with scientists about knowledge. I care that people are committed, that they are engaged in the topic we are discussing. And I remember that when I was a small girl, I was asking my dad, and he was talking about a fire. And I asked him, how is it to stay in smoke? And he put me on a chair and asked me to close my eyes and started to rotate the chair. And once it stopped, he told me, "Show me where Mom is." But I didn't point directly. And at that point, Dad has shown me that thanks to commitment, I can understand how it is to stay in a fire. And experience is a part of good education. So giving opportunities to experience is a key. And I'm giving a broad smile to you now, because I know if it's by a coincidence, but in my scientific life, I had to ask the same question that I asked my dad. How is it to stay in smoke? And because I deal with fire safety, I have organized the first in Poland evacuation experiment in a real tunnel, in a real situation, with a real smoke and with real people. Who did I invite to this experiment? My students. That's obvious. And my students were excited because they didn't have to go to school, they were to watch a tunnel, and they weren't interested in the situation. And I prepared the fire for them. So I just organized a smoke for them, and the coach stopped. So the old infrastructure worked as if there was a fire. So everything was on the spot, in place, and I just was wondering how my students would react. Because once I wrote my doctoral thesis and analyzed how people behave in accidents, so the facts are that people do not evacuate in a situation of fire in a tunnel. So they stay in cars, and then they are found dead inside their cars. So you do not evacuate, and you... So in order to explain it, I wanted to do an experiment and to see how people would react. And here is a video of people in the couch. You can see the siren beeping. There is no access, internet access in the tunnel. So people are staying in the couch and laughing, talking. So the students stayed in the car, just like the participant in a tragic disaster in Mont Blanc, when with one cigarette butt from in front of the tunnel, 39 people died inside the tunnel in their cars. So why? So the stress model describes this phenomenon. When you are in unknown, stressful situation and in danger, you have three types of behavior: fight, or try to extinguish the fire, flight or escape, or freeze, stay. And once you don't know the infrastructure and it's limited, you usually freeze. So you can see the smoke, you can hear the alarm, yes. There was a communication, attention, there is a fire in the tunnel, please leave your vehicle. And what? They are staying. The girls at the front said if there was a real fire, they wouldn't say so. Yes, they would. So this is the first sad conclusion, that people do not evacuate. And the second conclusion is the fourth attempt, because there were many of them. So on the fourth attempt, the students were to evacuate from the tunnel, which they were familiar with, but there was so much smoke that once you had your hand in front of you, you couldn't see it. Just have a look. So you can see you grinning, and I didn't feel like laughing, and I was lying on the ground to film it because there was poor visibility there. And then my question, how is it to be in smoke? So the infrastructure didn't help in evacuation. You couldn't see signs. People were just falling down, and the saddest thing is that they were so disoriented that they were moving one side to one side, then they were going backwards. And if there was a real fire, all of them would die because they went towards the fire. So what is the sad conclusion? You do not evacuate, you stay in smoke. And in smoke, you are disoriented. And I wanted to talk about experiencing in education, and I would move on to a conclusion, but this experiment was very educational, and that's obvious. Even more than showing a video like this, which is impressive. So just a traffic jam in a tunnel. Nothing is going on. Once, breaking two basic rules caused a major accident. And this is a very good method to show a video in education, but it doesn't help you to experience. But you have adult learning models, and this is a Kolb's cycle, on which it is worth basing your training and workshops. And I have been doing it for many years. So I usually engage people. So I organize a role play, a simulation, I use a game, or I describe a situation, I show a video. This is something very simple, but you need to invite people to engage. And then reflection. So I moderate discussion, and I'm asking what's happening, how do you feel, what was important to you, what have you noticed? And based on this reflection, I'm moving on to knowledge, because this is where the transfer of knowledge is working. So mini lecture is great here. I hate lectures, I'm not doing it, but you can invite participants to develop theory, and then you can move on to transfer, to practice. So this is the role of a trainer here, to present valuable information, asking about what is valuable to you, what is of importance to you, where would you like to start? And any form of engagement is excellent, but it is of great importance to follow this cycle because this is how the adults learn, and this has been scientifically proven. So there is a great difference between knowing things and knowing how to do things. So what is of key importance in health and safety? And here I will show you one of many methodologies that can be used. And the good news is that you can do it, especially the ones of you who have children. This is the EDIC model. So once you want to learn to teach a skill, you first explain it. So you're explaining what's going to happen. So I'm going to teach you this or that, and then we'll move on to this and that, and then you will do it on your own. Then you demonstrate on the second stage. So I'm doing and you are looking. The third stage, imitation. You are doing and I'm watching. And in the fourth stage, I'm giving you feedback. I correct you. And you are listening and drawing conclusions in order to consolidate this newly acquired knowledge.
And when you were teaching your children to draw something step by step, probably used the same methodology. And, dear ladies and gentlemen, the last thing that is very crucial in efficient education, even most important, is relation. And I have 14 years of experience in didactics, but already for the last during the last few years, my students started to appreciate my methodology, and I received the title of a teacher with passion. I received an award in Warsaw and also in Lesser Poland Voivodeship, and all this thanks to the relation, which I cultivate very consciously. And this is the basis of any educational experience. And what helps me with that? Well, first of all, I make sure the atmosphere is good. And one day I heard this sentence, start to like your group before you see it. And this good attitude, leaving private mood experience behind the door is really pays off. It gives space also to share experience. I also always give space to share experiences, but I also noticed that teaching adults it's not only about creating space for sharing experiences, but very often there is a big need at the beginning among adults to share their own experiences. So probably each of us is the same. We have certain experience, certain knowledge that we want to share. And when we do that, we make the participants more open. I really appreciate engagement. I ask questions, and I also like sense of humor. I like when it's funny. Alan Bloom, in his book, Closed Mind, wrote that the biggest problem of education is focusing only on transferring the knowledge instead of gaining the knowledge constantly. And very often, our goal is to create space so that the participant can gain the knowledge continuously. So to summarize, how to teach efficiently, for me, those three pillars are really crucial. Obviously, the substantial part is important, the goal, building motivation, self-awareness, but my experience tells me that in efficient teaching, these are the most fundamental things, so engagement, experience. Thank you very much for your attention. Thank you for this presentation. As you see, you can talk about very complicated things in a very simple way. Please stay with us, take your seat. And I'm going to explain you the last point of our program, and I will introduce the third panel, a discussion about the technological component. Technological development is an industrial revolution which gives us opportunities to improve the security and health of the employees. But new technologies are also related with new challenges at workplace. ZUS is trying to come forward the new solutions, and through the prevention programs, it's trying to improve the conditions of work. I would like to invite you to the discussion panel, Technological Development as an Ally of Responsible and Innovative Prevention, and Natalia Schmidt-Polończyk is going to moderate this discussion. So now I would like to invite our panelists to take their seats. Dear ladies and gentlemen, once again, good afternoon. Technologies. Who doesn't like them? Technological development is present in our everyday lives, whether we want it or not. We want it, we work on developing the technologies because it makes our world, our work nicer, simpler, and also safer. And today, in the context of safety, we will talk about technological development and also in the context of prevention. So let me introduce my panelists. We have Professor Rafał Mrówka from the Warsaw School of Economics. We have Madame Ada Florentyna Pawlak, PhD from SWPS University. We have Professor Zbigniew Burtan from AGH University. We have Joanna Kamińska from Central Institute for Labor Protection, and Jakub Chojnicki from State Labor Inspectorate. Welcome. In our panel, I prepared a question for each of you, but before you start to answer my questions, could you please extend this your professional context? So please tell me what you actually do professionally. And let's start from Professor Rafał Mrówka. Dear Professor, what particular technologies resulting from remote work or other processes turned out to be crucial in building our new economic reality? I mean, also post-COVID reality, taking into consideration the current geopolitical context. Rafał Mrówka from Warsaw School of Economics. I am a professor there, and I am focusing mainly on leadership and the impact of new technologies on management of organizations. I also lead MBA programs in Warsaw School of Economics. You're asking a bit about the past, but I would like to look into the future. Okay, let's look into the future then, because we are just at the brink of complete revolution, which have already started, but we do not entirely feel the results of this revolution. And here I mean AI, obviously, because this is the technology which, in my opinion, is going to change our lives in all aspects, in each area. And additionally, apart from the AI revolution, which in its own would be one of the biggest revolutions that took place in history, in parallel, we have another revolution that is very efficient robots these days. So combining those two aspects in one moment is a change that worries me a lot personally, because apart from seeing a lot of positive aspects of the situation, I also see a certain problem, because we are reaching a certain stage where machine is going to think better than we do. This is already happening, and apart from that, the machine is also going to perform manual tasks better, in a more efficient way than we do. And then the question is, where is the place for us, for employees, for scientists, for lecturers, and each of us? If you follow the new trends, future experts say that there's nothing to be scared of because we don't know these professions, these new professions yet, and they're going to appear in our surroundings. So this is an optimistic version, but I am a bit more pessimist, but I think I am an exception. So if I were to look into the future, then this would be AI. But if I were to look into the past, then I would say that the remote work and all technologies that enabled it were kind of a revolution. But I think it's a small revolution compared to what's going to happen soon. Thank you very much. Going back to the topic, Madame, what are the challenges related with the development of the interfaces between a human and a robot? And let us address the sad vision of the future, so lonely society, and how alpha generation is going to impact job markets. Yes, I'm related with SWPS University, and I also work in the Center of AI and Cybersecurity of Łódź University. And together with Professor Orliński, we were conducting research about how children, especially alpha generation, so children between the age of 9 and 14, how they work with AI. And what was especially interesting to us was how their well-being impacts the cooperation between a human and a machine, what questions they would ask. We cooperate with psychologists, obviously. It's not very easy to conduct experiments with children. There are a lot of criteria to be met. We had great experts helping us. There are also Microsoft schools which have very developed tools. But three main conclusions that surprised us, because we all know the Maslow's pyramid, which was created in the 60s and which was setting the structure of the needs at that time. But our research showed that security in the imagination of the young people is not anymore a need, but a sense of belonging. And as Professor said, AI, robotics, where is the place for us? Because they replace certain competences like manual work and so on. But there is also artificial empathy, artificial intimacy. So getting into relations with systems, which for us, for the millennials and further generation and older generations, is completely unimaginable. I was also conducting intergenerational research in the perception of chatbots, which encourage people for friendship and intimacy. And for certain generations, it was really an absurd to get into interactions with some artificial creation. But further generations, especially alpha generation, was really happy about it, because the chatbots would send them some music, some codes to games, and they were present 24/7, first of all, which is not so obvious in the human relations. Let's imagine how the well-being of children online looks. We know that it's not really good. There's a work of Jonathan Haidt, and the Next Generation book, I recommend it to you. The professor talks about what we were all thinking about, so how it is to grow up in this in the current world, and they were talking about the well-being. And now we go one step forward. So not only social media, we are going into the stage of synthetic media. That means that we are getting into relations not with people, but with fictional creations, and we call these relations parasocial, because on the other side, there is no one apart from the managers of algorithms who monetize the data of the children and who make them really addicted biologically. So it's good to look at those who put their children, for example, the creators of SpaceX, they put their children into schools which are completely out of technology. So they are really learning all the manual skills and so on. So that's what I've been doing for the last years very intensely. These are social contexts of AI related with the future of relations. But it will also be part of the leadership, building intergenerational teams and our mutual practice of generation, because exerting influence through the algorithms, is that we can bring any agenda without any responsibility. And in this research on children, it turned out that the respect that they give to AI is the same that they give to a human. This is not the case in other generations, because we are aware that AI can be wrong, that this is just an effect of programming. And for the children, it's not the case. Remember that now we are in the era of AI natives, children which enter the world where the simulation, this artificial world is something that the washing machine and fridge was for me. I have one more question. Is it already happening today globally, what we research in the reality of our alpha generation? Or can these phenomena be already observed on other continents? Yes, and a direction, interesting direction is Asia, Japan, South Korea, where those solutions already appeared 10, 15 years ago. And we do not only have the Ministry of Solitude, because Japan is suffering for a big demographic crisis, because they call many people hikikomori, over 1 million people. These are people who live with fictional companions. They have intimate relations with fictional characters, so they do not really have them. They do not leave their houses. So the level of solitude is really high, with a huge risk. Well, this is really scary. We are talking about psychological, mental well-being, and I will not stick to the order, but I would like to mention this topic of mental well-being. Our social awareness about it is growing. There is research of Caroline Rife, for example, who says that mental well-being is based on 6 main pillars: self-acceptance, development autonomy, managing the environment, and human relations. And now a question to Joanna Kamińska. In the context of technologies that we are discussing, whether digital or based on AI, and that we use more and more often, how do they influence our mental well-being, our psychological and physical condition, which support them and which don't? Good afternoon, Joanna Kamińska from Central Institute of Labor Protection. I work in the Department of Ergonomics, and I am a biomechanician, so I will not go too deep in psychology, but the colleagues from our department conduct a lot of research related with new forms of work and how freelancing impacts mental health. And they identify a lot of risks. We have a lot of materials related with this. I personally focus on a physical burden during work, and the technologies also will have impact on that. I would like to also refer to the first session where we were talking about health in various aspects. And the importance of our health in terms of various risks, including also technologies and the sedentary lifestyle, because technologies will have impact on the decreasing number of workplaces, like simple ones, repetitive, because robots will replace them. But on the other hand, there will be more mental requirements and more sedentary work. And this lifestyle, which I think is the basic risk for our health, because not enough physical activity is a fourth cause of deaths. It is strictly related. The low physical activity is related with higher risk of diseases, not only obesity, but also diabetes, type 2, cardiovascular diseases, cancers, mainly breast cancer or intestine cancer, which increase by 20–30%. Low physical activity increases the risk of becoming ill. So these are the mechanisms which are really related. And the statistics are not so optimist either, because WHO says that 60 to 85% of population is not active enough physically. Even in my surrounding, in our institute, when we have the possibility to use sports subscription cards, I see how few people use them. If I asked you, for example, which of you exercises regularly, probably there wouldn't be so many hands raised. Oh, there are a few. Good. And I would also like to stress that we should try to achieve it with small steps. On the one hand, regular activity that was mentioned by the professor from Physical Education Academy, but also what we do on a daily basis, walks or even cooking, cleaning, doing laundry. This is also some physical activity which supports our health.
So you have been active today because you have doing respiratory exercises, so we can include it as a form of physical activity. Now the question to Professor Zbigniew Burtan, education. Something that is really important and vital for the future. How technological change affects education? And I'm wondering about all the topics we have touched upon. The development of technology will make specialists, health and safety at work, specialists to acquire new skills or maybe to reskill. Good afternoon. Thank you for having me here in this during this excellent conference. And just to follow up on what you have said, I represent the Akademia Górnicza Hutnicza and the Department of Human Resources for Mining and Construction, the two sectors in which health work safety is of extreme importance because of a large number of accidents. And I specialize in work safety, and I'm the deputy dean of this department. So coming back to your question of technological development, yes, there are certain threats, but I wanted to pay your attention to benefits. It is not so that we are just approaching development, because when we celebrated 50th anniversary of zoos, there were no computers. It was just the launch of digitization, and the staff members had to adapt to the progress and technological changes. And the same was true about the specialists in work health and safety. And these rules have contributed to greater efficiency and also to safety, because equipment automation has moved people from dangerous jobs who have been replaced by automation. But also the sensors have been very useful, especially in mining, which has extremely high risks. but also prevention, active prevention, thanks to which, although accidents happen quite often in these sectors, still these accident rates are much lower than at the times when there was no automation or digitization of technology. So it is very important that research institutes and universities translate knowledge to improved work safety thanks to the use of latest technology. And this is what we are doing, and other universities do it as well, because even at the stage of secondary vocational education, we are including technological progress and the introduction of innovative processes. And on many occasions, we provide opportunities for young students to come to a workplace during their training and experience it, have hands-on experience. There was a question whether specialists work in health safety. So will these experts need to acquire new skills or reskill? No. Work safety experts should upskill, and they shouldn't worry about their jobs. They need to adapt to changes and new technology, but they also need to diversify their knowledge, because a work safety specialist in a coal mine needs to be a miner. They need to focus on specific industry-specific requirements, and as a result, they will make sure that these specific workplaces are safe. Thank you. Question to Jakub Chojnicki. I wanted to ask about the inspections and the development of technology. How, in your view, it affects the accident? I'm the head of the inspection and control, so we focus on prevention and inspection, and we are offering support to plants that we inspect, and we are considered experts. But this means that we need to upscale on a regular basis. We are in the process of learning all the time because we need to catch up with reality. And it is not an easy task because state agencies are very specific, and we find it really difficult to acquire experts who can conduct inspections, because this is not an easy job. And when latest technology is a great opportunity for us, because you can remove dangerous and harmful substances from human beings. So, for example, if you can replace a human being by a robot when there are explosives, for example, in play. So this is really good. So, as anything in life, you need to do it carefully. So, for example, everyone loved asbestos in the past, and now we know that it is not safe. So, new technology in irresponsible hands will do more harm than good. So what's going on in workplaces? Automation and robotization means better work safety and improved work culture, because there are different requirements for operating sophisticated machines. And although machine operators can be considered workers, they are highly skilled workers. and they need to acquire knowledge on how to operate quite a sophisticated machinery, which is quite expensive, and to make sure that it is effective and that it brings profits to companies that have invested in them. So technological development is important, but you need to take ownership of it. You need to be responsible, and you need to harness knowledge to make sure that it is safe. And we are not catching up. The law is behind reality. The legislation is not ready, and human resources are not ready either. But we are working hard to be well prepared. For example, we will have offshore wind farms in Poland, Baltic 1 and 2, and there is not a single piece of legislation concerning power generation, offshore power generation in Poland. So even the operation of wind turbines offshore is a different question than maintaining wind turbines onshore. So this is how I would complete my answer to your question. Let me add, as far as wind farms are concerned, at our institute, we conduct work to make sure that safety is ensured in new jobs. Thank you. It is great because we are just mid-term in our discussion, and now I would like to ask you one more question. And I would like you to focus on work safety more from the point of view of prevention. So one question to all of you. What specific technologies that you use in your industry sectors have the best potential to become the tools, innovative tools of prevention in order to minimize the risk of accidents or to limit health threats? Well, I will not reinvent the wheel by saying that this is the automation, because if there are no people in dangerous places, there will be no accidents with people. So apart from the fact that I work at university and I teach leadership, I am also a consultant in business, and I am well aware that if you prevent people from entering some dangerous places and you have a machine that can enter it and although people will be prevented from entering this specific space, there will be people who would go there anyway. But when you look at some warehouses, modern warehouses, for example, Intercars company, how many people work there and how many machines are employed there, how many robots are used there, it appears that there is no room for accident involving humans because there are no human beings inside. So when you see some robots who can dance or sing, well, this is already happening, and there are great revolutionary opportunities because robots can climb the stairs or who can carry parcels. Obviously, they can be highly specialized. And you can see robots that are fighters in war, and they can eliminate one another. They can eliminate drones and other robots. And this is no science fiction. This is reality. Just talk to soldiers in Ukraine, and you will realize how far things have gone. But from the point of view of a future industrial plant, the technology is of key importance. And as I have said, this is not all, because this human factor is also important, although you have robots who can think and move quite efficiently. So regardless if you are sitting in front of a computer or doing some other job, well, you may not need to sit in front of a computer anymore because there can be a machine that can operate other machines. But the question is what people would do then. And this is the fundamental questions. What people will be needed for? What jobs they would have to do? So at some point, I have become a proponent of basic income, basic level of income, because this is the future of the world. And in general, what is important now, you shouldn't look at individual technologies. You should look at the interoperating technologies that intertwine. And let us have a look at artificial reality or augmented reality, virtual reality. There are different names for this technology, and it can be of great importance in the future, and it still opens room for innovation. And it may appear that even if artificial intelligence is not capable to do something, yet human work can be in one place and machine can be somewhere else, and they can work remotely. For example, drones, they are not operated by human beings. Yet there are no pilots in them. There are people who operate them in some centers on the ground, not in the air. And they make decisions, very difficult ones. And I wonder whether artificial intelligence would not be better at making these decisions that they face today. Well, I've been thinking about virtual reality and telework, because as with any technologies, you have pros and cons. And DR would be great to avoid mistakes in education, for example, for example, in the case of medicine students that can make mistakes while learning, without the additional stress. But the question is it right that we, human beings, are selling off a lot in order to ensure safety? So, for example, how different childhood is now from the childhood of 50 years ago. And so we focus on physical reality, but we do not focus on virtual reality and online presence. It will be not surprising to you to say that artificial intelligence, just like any other technology that defines our era, so it will not be important what it is capable of, but it will be important what procedures we have to use. For example, social media by children. We know that children younger than 13 use social media. They are sleep deprived. So the technology itself is not evil. Social media are useful, and they are profitable for us, provided they are used wisely. And there is no educational package that comes with a mobile phone that is given to 5-year-olds when the mind of a 5-year-old is not prepared to use this technology. So just to wrap up, I believe that we will pay a lot for our safety. So we will trade in our privacy, which is already happening or has happened. This is not the question of the future. We have a Polish company, Samurai AI, which is searching discussion fora where young people leave a trace and they analyze sentiments, so they analyze the language used in order to identify people with depression. And if you enter their websites, you can read about their services, but still, even today, some people, when we do our service of well-being, because you want to moderate, you want to control everything, and it is really a great luxury for young people to have a hobby that is not monetized, but it is even sleep that can become monetized. So I believe this is the song of the future, but still there will be still a lot of conflict between privacy and technology, because artificial intelligence will be connected to virtually everything, and it all will come at a cost. It will redefine us as human beings, and it will redefine our communication, and we need to be transparent about it. Thank you very much. Professor, over to you. What specific technologies? Well, let me reassure you that automation, digitization, robotization, AI will not eliminate human beings from work. If we wanted to do it, there are still areas of industry that highly qualified workers are needed, because all these innovative processes, there are certain breakdowns or blackouts, and you need to remove the results. You need to maintain the machinery. So maybe, and these tasks are really important also from the point of view of safety. So even if machines cannot replace humans, the new innovative solutions will allow us to become informed about threats. For example, let me give an example from the mining industry. After the war, there were hundreds of accidents, fires per year, and many hundreds of people died. These accidents still happened, but for more than a dozen years, no one has died because people are informed in time, and they can be evacuated in time. And this is thanks to the latest technology.
But also when it comes to education and didactics, I think what is also important in education is the virtual reality, because these days it can be very dangerous. It can show us, present us, simulate certain dangerous situations so that we can know how to behave in those situations later on. And we can, they can teach us certain reactions, certain behaviors. So here, in the sphere of education, I see the possibility to apply those modern technologies. Yes, especially in dangerous situations. I agree. In our institute, we have conducted research, and we were asking people what are their hopes related with technology. And it turned out that mainly medical diagnostics and improvement and better impact on our health. On the second rank, there are investments in ecology and environment protection. But on the other hand, in the same research, it turned out that we had really high expectations, that there are a lot of those robots and technologies, that we are surrounded by them all around. And when we compared it a few years later, it turned out that there was not so much of this robotization. I saw robots when I was doing my internship, and they were really replacing the employees. But on the other hand, there were certain forklifts that were helping the employees to take the semi-products, and it took a few years so that employees started to like those new solutions. So I think we need to have some openness in order to try various new technologies in the activities where robots cannot really replace us. Indeed, what you said, the development of technologies can be very, very fast, but there's also the so-called resistance to the change. We're not always open to changes. Yes, well, being the last one has its pros and cons. The disadvantages that the previous speakers managed to areas where I also think certain things will be improved. These are, for example, virtual reality trainings. They already take place. One of our railway companies that builds new railways and new networks is already training their operators who disconnect very high voltage on the sections, and they do it in virtual reality. All the activities are transferred one-to-one into the virtual reality. So everything is displayed in those VR goggles. So they move away all the dangerous factors from the employees. And thanks to this, in real life, maintenance or construction work related with disconnecting the power from the network, from the grid, they are performed safely. And exoskeletons, let me calm you down. There are some enthusiasts of the new technologies, but let's remember that if the revolution continues, it's not going to be as dynamic as in the Far East, because we need to remember about one thing. In our country, over 90% of companies are micro companies. And robots are not are quite expensive. You need to spend some resources in order to buy the robot, to optimize your processes, and it's not so easy for companies which are just struggling and struggling to survive on the market on a daily basis. So probably, yes, one day, but in Poland it's going to take place much later than in the countries which are already more advanced. These are the countries mentioned by Madame here. So everything encourages us to use those new solutions, but let's do it wisely. This will also be areas for people who focus on work, health, and safety, because we will need some new rules, some new frameworks for the work between humans and robots. So the robots might do their work according to the procedures, but then the person entered into the area of the arm of the robot, and it was very harmful for the health of that person. So such accidents are going to take place everywhere where the procedures are not implemented correctly. And this awareness, we were talking about the awareness many times. I am really an advocate of this, but the only way to create higher culture of work in Poland are trainings, prevention activities, additional activities, creating various events at workplaces, something that was not there before. For example, those proverbial Fruit Thursdays, or some events like kayaking together, integrating people and talking about what surrounds us at the workplace, allowing the employees to speak, listening to them, getting rid of this situation where the director always knows best. Because I'm convinced that, it doesn't always function like this. So, once again, awareness. Thank you very much. Our time is up. So, if we were to sum up our discussion with one word, because there were a lot of topics, a lot of visions. The technological development seems to be inevitable and related with various aspects, not necessarily positive. In the previous panel, we were talking about opening intergenerational teams, now robot-human teams. There are a lot of challenges, so let's try to summarize it. 2 words from each of you. Is that possible? Yes. Yes, let's learn to cooperate with technologies instead of fighting against them. Yes, let's talk to our children, grandchildren, with everyone about what they like in the media, why they like to talk with AI, because we can really find out a lot about our mutual relations. Getting back to the awareness, let's create, reinforce the awareness of employees. The society is aging. It's hard to reach the older people. So we need some changes here. And now, big thanks to Madame. We saw new ways of education, those soft skills, for example, interpersonal skills. They're very important in the era of technological changes. Yes, I wanted to add the openness to new technologies, new people, to learning, so that our cooperation works well. Ethics, responsibility, caring for other people, and not being blinded by the new technologies. Thank you very much. Thank you, and I'm giving the floor to the host. Thank you. Thank you very much for this interesting discussion. And thank you for moderating the discussion. Dear ladies and gentlemen, our conference is coming to an end. Once again, I would like to thank everyone for your presence and participation, to those who were here in the headquarters of ZUS, but also to those who were connecting with us through YouTube platform. We would also like to thank our guests from abroad. These were guests from Austria, Belgium, France, Germany, and Switzerland. Thank you once again. And we encourage you to work together for the security and health protection. And we also encourage you to use prevention services of ZUS. Thank you very much.